There is still no agreed upon definition of long COVID, but it is largely described as a collection of symptoms that develop during or following COVID and don't go away for a period of time. What is this period of time? Some studies say a person has long COVID if symptoms last beyond 28 days, while some indicate a longer period beyond 12 weeks. However, while medical experts debate the technicalities, the common thread is lingering health problems even after they recover from the virus. Also, long COVID symptoms can differ for patients and can sometimes be prolonged, severe, and unexpected. Those who have suffered a more severe case of COVID or have co-morbidities are more susceptible to long COVID. However, doctors point out that those who have suffered a mild or moderate case of COVID-19 or have even been asymptomatic can suffer from long COVID as well. A study conducted in the US on those who contracted mild to moderate COVID reported that 40% suffered from long COVID symptoms such as inability to pay attention. There are no specific symptoms of long COVID. In fact, one study which analyzed over 3,700 patients from over 50 countries in 2020 estimated the prevalence of over 200 symptoms. People have complained of shortness of breath, depression, headaches, intermittent fever, prolonged loss of taste and smell, hair loss to cardiac, kidney and lung impairment. However, the most lasting and common symptoms have been documented to be fatigue, shortness of breath, coughs, joint and chest pains, and brain fog, that is, problems with memory and concentration. Long COVID has been linked to organ damage. For example, a bad case of COVID can cause scarring of the lungs, which results in symptoms such as shortness of breath even after mild exertion. Doctors point to inflammation of heart muscles, which result in palpitations, rapid heart rates. It can also raise the risk of long-term kidney disease, impact blood circulation, and some have even developed signs of type 2 diabetes. Children could show similar symptoms such as fatigue, depression. Heart inflammation is a concern, especially amongst children, athletes. Doctors also point to a rare COVID-19 complication in kids called MIS-C, multi-system inflammatory syndrome, a condition where different parts of the body get inflamed. There is no timeline for how long the symptoms of long COVID last. Some studies indicate long COVID can last up to a few weeks to months to more than a year, but does it last years? Hopefully not, but we don't know as the virus has only been around for 2 years, so we don't have long-term data. Currently, there is no treatment for COVID. One can only provide symptomatic relief and gradually increase activity where possible, as per experts. Lastly, it is extremely important to point out long COVID and the link to mental health, say experts. Physical symptoms of COVID along with long periods of isolation, losing loved ones have left some people with depression, anxiety and post-traumatic disorder. In addition, long COVID can result in or worsen one's mental state. An example to illustrate this better is the symptom of loss of smell and taste. Losing one's smell and taste is not life-threatening and for most resolves in a few weeks if not lesser. However, experts point out for those who have prolonged distortion of these senses, it can result in lack of appetite, anxiety and depression.